My name is Chris Baker, and I teach a medical anatomy and physiology course at a high school outside Philadelphia in the United States. Our course consists of 3 parts. The first part is the traditional bookwork that students normally do in an A&P course. The second part is the dissection that students normally do in an anatomy and physiology course. The third part of our course are live case studies. We do the case studies so that our students, many of whom go on to medical school, nursing school, occupational therapy, physical therapy, wide range of medical clinical applications. The goal of doing case studies is so that these students get an idea of how to interview a patient, obtain a medical history from them, as well as complete a physical exam on our patients. The two together we call history and physical, or H&Ps. So the goal of this is to have my students get an idea of what it's like to evaluate a patient, to ask the right questions at the right time, in the right order, and do the detective work to evaluate a patient, come up with a list of potential diagnoses, which we call our differential diagnosis, propose diagnostic tests, and come up with a clinical impression as to what they think is wrong with our patient, and a treatment plan. The problem with doing this in a 100% virtual or online space is we don't have the face-to-face ability to do that. Because normally what I do is my students will interview the patient and evaluate the patient. I play the role of the patient usually in the classroom. I sit in a chair and the students sit around me and they come up and they ask different questions. It's almost like a Socratic seminar. It's very difficult to do that in the online environment. How do we do that? How do we do it synchronously and asynchronously? It's got to be a practical way to do it, and it's got to be low cost or free. Free is preferable, and accessible to all my students on all the devices they have. We are fortunate enough to have a one-to-one laptop program at our high school, so every student has a laptop. They also generally have cell phones, most students do, and or iPads. So I found a solution to be Microsoft Teams. And in this presentation, I'm going to show you how our live case studies run. I'm also going to show you what our history and physical forms look like, how I set up Microsoft Teams channels in order to reflect those history and physical forms. We're going to look at an example of how a Teams case study discussion works and how it unfolds. It is an actual discussion from this past spring 2020. And lastly, we're going to look at analytics that Microsoft Teams provides us to look at student engagement. So what's going on today? I have chest pain. Can you tell me when your chest discomfort or chest pain started? About 2 hours ago. Can you tell me where in your chest is your chest pain? It's right about here, this left upper chest. Can you describe the quality of your chest pain? Some characteristics? It's like a pressure or squeezing. On a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain you can imagine, where are you at right now, roughly? I guess it would be about a 6 out of 10. Is there anything that makes your pain better or anything that makes it worse? No. How's your breathing? Are you short of breath at all? Yeah, it is a little tough to catch my breath. Do you have any nausea or vomiting? I am a little nauseated. Do you have something I could throw up in? Any fever or chills at all? No, not recently. What kind of medical problems do you have as far as past medical history? I have high blood pressure. Do you have any other medical problems other than high blood pressure? I have diabetes. Do you have any other medical problems other than high blood pressure and diabetes? No. Do you take any medications for your medical problems? I take Vasotec and Glyburide. Okay, so now it's time to start taking a look at you. We're going to do what's called a physical exam, okay? So what I would like you to do, please, is put your arms out like this in front of you, palms up, and hold them there for 10 seconds, okay? So this is the history and physical form that I came up with. It's a compilation of a lot of different forms out there by different institutions across the nation, and I added some custom points to it. So basically, briefly, here it is. The first section is the primary survey, which is what we need to address in the first 30 seconds of a patient encounter in EMS. Scene safety survey, looking at skin color. Are they pale? Are they cyanotic? Are they flushed? Level of consciousness. Check major circulation and stop any major bleeding. Take care of the airway and breathing. After that, we're on to the patient's chief complaint, which is what is going on right now, and history of present illness or HPI and mechanism of injury deal with the events leading up to the medical problem or the trauma. Review of systems is a standard set of questions that we ask every patient in order to look at all their body systems, whether it's a heart and cardiovascular or vision or respiratory. Okay, then we have a section here for past medical and past surgical history, medications and allergies, as well as social history. Here we have a section for vital signs, and now we're into the physical exam. In general, what does the patient look like? Then we do a head-to-toe pretty much survey, hands-on, checking out the patient, and we can mark on this blank diagram any anomalies that we find. Then I have my students take all the information that they've gathered from the history portion, from asking the patient questions, to the physical exam, to the hands-on exam that they do, and come up with 5 possible issues that could be causing our patient's problem. We call that the differential diagnosis. In addition, I have my students enter next to each differential their justification for including them. And then I have my students suggest additional diagnostic tests such as finger sticks, EKG, lab work, urine, x-rays, CAT scan, MRIs, ultrasounds. Then, after I give them the results, we jot down the results here. After I give them the results of each of those tests, then they narrow down this differential diagnosis here to one, what we call clinical impression. And this is what they think is wrong with the patient. And then they propose a treatment plan. So here we have our 5th period Microsoft Teams setup, and it's broken down into channels. You can make as many channels as you'd like. There might be some limits. I don't know if you can make 500 channels, but basically what you're trying to do is you're trying to set up different channels or different threads for chats. So for example, the general channel here is for general questions about the course, about how to use Teams, that kind of general stuff. And I created the following 15 or 16 total channels, and I named them sequentially 0, 1 through 16. The reason I did that is because if you name them 1, 2, 3, 4, 5, once you get to 10, the way it orders them numerically. So the easiest thing to do if you'd like to keep the order is do 0, 1 all the way down to 10, then 11, 12, on and on. So basically, in the first 30 seconds of a patient encounter, all the questions the students need to ask me for information should be done in channel 1. Channel 2 is chief complaint. In other words, what is wrong with our patient? So they're going to ask me questions about that in channel 2. Channel 3 is history of present illness. So at what point, so how's my chest pain? When did it start? Does anything make it better or worse? And so on and so on. Review of systems is questions about all the different body systems. Then there's past medical history, and on and on and on. And then we finally get down here to the diagnostic tests, clinical impression, treatment plan, and how are we going to reevaluate our patient. And this matches up perfectly with the H&P forms that we are using. So here's the correlation between the channels and teams and our history and physical forms. Channel 1 is the first 30 seconds. Channel 2, chief complaint. 3, history of present illness. 4, mechanism of injury. Review of systems is channel 5. So any questions the students need to ask me about review of systems. Do I have fever or chills? Do I have a headache? Any kind of weakness? Did I pass out? Needs to be asked in channel 5. If they ask it in an inappropriate channel, I will redirect them. And the cool thing is, you can link to the appropriate channel right there in your reply. So on and on and on. Past medical surgical history. Here's channel 6, channel 7, channel 8, and on. Vital signs, channel 10, physical exam, channel 11, differential, 12, diagnostics, 13. And we get down to clinical impression. What do you think's wrong with the patient? Based on the information and diagnostic results thus far, and the treatment plan is channel 15. And here is Microsoft Teams channels in action. So far, all these folks know as far as the simulated patient is that I was brought to urgent care by my neighbor who found me laying at the base of a tree in my backyard. And we're in the initial stages of figuring out what could possibly have happened. So they're asking me questions such as, what did I land on when I fell out of the tree? How did I land? On my right side, on my left side? Did I fall on my head? Ask me questions about how tall was the tree. This is all mechanism of injury. All has to do with trauma. Was I able to stand after the fact? How long was I laying there for? I throw in some curveballs in there. I start complaining about pain. I say, hey, can you give me anything for pain? I start complaining. In this conversation here, I tell them we're missing something. I know we're not face to face, but we're missing something. Keep digging, digging, digging. And there we go.
How high up in a tree was I? It's a 40, 50-foot tree, but I didn't fall that far. I fell 15 to 20 feet. One of the cool things about Microsoft Teams is the ability to run analytics on each channel and each team and break it down pretty well. So we go over here to Insights, and that's what Microsoft calls it. And we're going to click on Communication Activity. And we're going to click on All Time. And here we have. So let's scroll down here a little bit so we can see. Okay, so here we have the communication. There are 203 total communications between me and my students, and it breaks it down to posts and replies and reactions and breaks it down to a daily total here. And we can even pick a day. So for example, let's go to May 17th. And we can really break it down. So there were 7 posts and 6 replies on May 12th. On May 17th, we had 20 posts and 27 replies. And it breaks it down by student over here. This is for all channels for this particular day. If we want all time, these are all time communications between myself and my students.
I will definitely continue using this Microsoft Teams approach to case studies, even in the fall, if we go back in a hybrid model, or years to come when we go back face-to-face 100% in the classroom. I find it very useful for 24/7 asynchronous and synchronous discussion. It's much faster than posting questions and replies on a discussion board, yet it's much slower than a live text chat. It's a perfect blend of fast text replies and slow, thoughtful discussions. In addition, the ability to have robust discussions in which you can format text, you can add attachments to your replies or to your posts in Microsoft Teams. You can embed a video. You can even start a video meet, right from within the discussion. Makes it a very robust platform to use. I hope you enjoyed this presentation.